Good morning to those in western part of the globe. Good afternoon to those in central part, and good evening to those in the eastern part. I am Madan Rehani, President, International Organization for Medical Physics, and I am joined by Ibrahim Duhaini, who is coordinator of IDMP within IOMP. We shall be moderating the webinar, and Ibrahim shall help in question answer session. Thank you all for joining today on Sunday. I understand many of you may have compromised your engagements for Sunday. Many thanks indeed. Incidentally, we have one speaker for whom it is 6 a.m., another with 11 p.m., and thanks again. Happy IDMP to start with. Many amongst you may have organized activities in your own place to reach out to the people outside of our medical physics community and to let them know what we, the medical physicists, do. It is in this respect that we invited experts from outside the medical physics community to learn from their experience in communicating. We have three distinguished speakers today to enlighten us and share their experience in communicating with public at large. We intend to finish presentation in 40 minutes, past the start time, and then we shall have time for question and answer for about 18 minutes before we close at 60 minutes. Please use the chat box to write questions. May I also request participants to keep their video off so as to preserve the bandwidth, and the moderators and speakers will keep their video on. As per usual tradition, we make recorded presentation available on IOMP website within few hours, latest by 24 hours, and thanks to Magdalena Stuva, Chair of Web Subcommittee, for undertaking this task. With that, I will start with introduction of speakers. But before I do that, let me have the pleasure and privilege of announcing the names of IDMP Award winner. And let me present the slide. Every year on the International Day of Medical Physics, the Awards and Honors Committee of the IOMP considers nominations which are received from various parts. And we have this year the awards: Professor Balter, Dr. Fukuda, Michael Israel, Joe Petalward, Francis Hunsford, and Meshari Alwan. Congratulations to all the awards winners. I will now start with introducing all the three speakers. They will speak one after another without break on questions and answers, and all questions and answers will be at the end of the three presentations. Professor Joan Leach is from Australia. She is director of the Australian National Centre for Public Awareness of Science. She is chair of academic board at the Australian National University. She is Chair, National Committee for History and Philosophy of Science at the Australian National Academy. She has written books, and latest one being An Ethics of Science Communication, and also edited collections of Science Communication, A Global Perspective, which tells the stories of 39 nations and territories, attempts to raise the profile of science over the last 50 years. While remaining transfixed by science, she advocates for better science communication that critically examines the social impacts of science, technology, and biomedicine. She has also been a TED talker, and her topic today is why communicating the science is worth the effort. She will be followed by Jenny Erdmann, who is award-winning health and science journalist from St. Louis, Missouri in US. She is independent health science journalist, board member of the Association of Healthcare Journalists, co-founder of the Open Notebook, a science journalism organization. She left the world of science, cell and microscopes for writing and reporting. Otherwise, she specializes in genetics, aging, and end-of-life issues and wellness. Her work has been reported in various journals and journalism media, for example, in Nature, Nature Medicine, Discover, Science News, Family Circle, Women's Health, The Washington Post. She is a recipient of numerous awards and fellowship. She will be talking to us on communication is understanding waiting to happen. And finally, my good friend, Peter Rickwood, who is Executive Director of Atomic Reporters, situated in Vienna, Austria. He had his earlier life as an environmental journalist on Canada's largest daily newspaper. Then he was press officer for a decade at the IAEA, where we were working together for many years. Media advisor to the Comprehensive Nuclear Ban Test Treaty Organization, CTBTO. Then he also was consultant to the UNSCARE, United Nations Scientific Committee on Effects of Atomic Radiation. He founded the Atomic Reporters, and he has been organizing the training workshops, bringing specialists and journalists, professionals and citizens together to promote nuclear literacy and support more informed reporting. And his topic is journalists: love them, hate them, but you need them. How to make friends with the press and benefit from the results. With that, I pass on the control to Professor Joan Leach. And Joan, you can start.
Thank you so much, Madan. That was a lovely introduction. I appreciate that very much, and I'm really thrilled to be here to help you celebrate this International Day of recognizing medical physics. As is customary, I do want to start with an acknowledgement of country. I am coming tonight. It's the middle of the night here in Canberra, Australia, and I sit on Ngunnawal Ngambri land. They are the traditional custodians of the land, and I acknowledge them and their elders past and present. So I'm delighted to join colleagues tonight. And I want to kind of set the scene probably for my other two colleagues who are going to have very interesting things to say about how you do the work of journalism. I'm not a journalist. I do study what journalists do, especially as they cover science. And so what I want to do in my talk is to give you 3 reasons why communicating science is worth the effort. It's not always an easy thing to do, but why I think it's vital, urgent, and quite important. So, I noticed that I might not even need to give my talk this evening, because as I go through your journals and things that are going on in medical physics, there seems to be quite a bit of science communication happening. I found evidence of medical physics slams, where PhD students in 3 minutes give the latest about their research in medical physics. I note that curriculum all over the world has included science communication for programs in studying medical physics, whether you're doing research, clinical work, or even working with technology. So I noticed that there's a lot going on already. So maybe I don't even need to advocate for this, but in case you're not convinced, I will start with reason number 1. Why should you bother thinking about science communication? Well, the first reason I'd like to give you, and for some reason my slides keep moving along. Madan?
Can you go, you want to go back? Yeah.
I'm good, I got it now. Just a little bit sensitive here. Okay, so the first reason why bother. I'd like to make you think a little bit about the way in which science communication is part of what has been called responsible research and innovation. Now, colleagues in Europe will recognize this phrase of responsible research and innovation because it's been part of the funding situation, the funding system in the EU for the last 10 years for Horizon funding. And the idea of responsible research and innovation is that, or at least in relation to communication, is that we need to find ways in which many publics, audiences, patients, advocacy groups can engage with science and let their views, opinions, preferences be known. Now, this is usually presented as a way in which researchers and clinicians can be responsible. That is, they learn about things like patient safety, the reduction of error, helping to raise the quality, for example, of healthcare or those kinds of features to help people, and that's considered to be responsible. But the other side of this coin is innovation. And so another reason why you might care about science communication is not just because it's the responsible thing to do, but because it can drive innovation. And so there are more and more case studies around the world of researchers working with patient groups, technology end users, and other stakeholders for their research, and they're finding out unique things. So for example, in some cases, we make trade-offs, and all researchers know this. Sometimes we trade off accuracy of our results for getting them quickly. Sometimes we prefer to get things fast, and sometimes we prefer to get things right. Now, in the best of all possible worlds, we'd have both, but we know that there are trade-offs. So researchers are used to making these trade-offs in certain ways. However, we also know that patient groups and other end users of our research might make those trade-offs differently. And it's in negotiating those trade-offs in conversation, sometimes those conversations are quite difficult, but in conversation that helps to drive innovation. That is, it can help improve the quality of technology, improve the quality of healthcare by bringing those groups into the research from the beginning instead of just telling people results at the end. So this is something that responsible research and innovation has advocated for 10 years, and it's beginning to see a lot of results. However, the sticking point has been encouraging researchers, clinicians to actually do the engagement work, to have those hard conversations. So that's the first reason I want to give you about why bother, because some of these hard conversations can help make research better. If you're interested at all in the kind of techniques and tools available to help make some of these hard conversations go well, the EU has a Responsible Research and Innovation Tools website that I would encourage you to have a look at. And it gives you some ideas about how to start those conversations, even if you are working on research on technology, how you can get end users involved from the very beginning. So I encourage you to have those conversations, because I do think it is one way in which innovation is currently being driven. Now, the other issue about responsibility and responsible research and innovation is about trust. And we've heard a lot over the last 2 years globally, as we've all worked through the pandemic, about trust in science. Well, it's still the case that despite a lot of concerns about misinformation and other issues, that scientists, researchers, are trusted just about more than any other profession. So people expect researchers to be trustworthy and to engage them in these hard conversations. Now, it varies across the world, and I typically have the Pew Research Center's research kind of on my tab on my computer so that I can look at it as they update it. But here's a little snapshot around the world. In Australia, where I am, researchers are seen to be very trustworthy. And part of the reason for that Pew found was because researchers are very available for public conversation. This is also true in India. As you start working down, we find that other areas, for example, in my region, in Taiwan and South Korea, that researchers are not as available for public conversations, and that the trust metrics kind of go down. Now, these shift over time. They're quite interesting and engaging, and I encourage you to have a look in your region, because this is the kind of baseline on which you can go and have conversations. So that's my first reason. Why do it? Well, you need to do it to be trustworthy, responsible, and to drive innovation. The second reason I want to give you, the second reason I want to try is to say that, okay, Madan, I don't know who's driving here, is that we should bother communicating with audiences because they want to know. Also, research from the Pew Trust, that it was global, is that publics hold researchers in high esteem and want to have conversations with them, but have concerns about specific areas of science and technology. The Pew draws out their concerns over AI, workplace automation, and food science. What's really quite interesting, though, is in research that we've done here in Australia, which has been duplicated elsewhere, that people seem to care about a really interesting nexus of topics, okay? So if you look at what people want to read or want to find in their news feed, or want to what they go search for online, they're interested in health issues, scientific discoveries, new inventions in technology, environmental issues, and new medical discoveries. So what I would submit to you is that medical physics seems to be right at the perfect nexus of what people are interested in knowing about. So instead of thinking about yourself as on the back foot to having conversations about the kind of research and the kinds of treatments that you might be interested in, actually, the cases are slightly different. People are keen. They want to know about your research. These are the topics that they care about most. Now, for those of you who know Australia a little bit, it's a country that is mad about sport, cricket, football, tennis, you name it, absolutely mad about sport. And our research has continuously shown over about 20 years that people claim to want to know about health issues, new scientific discoveries, inventions, environment, and new medical discoveries more than they want to know about sport. Now, I don't believe this, even though we found it, it's a robust result. We find it again and again, all kinds of reasons why we might question this result, but it's interesting that people will say this, okay? So science over sport. So my second reason that I want to give you for communicating science is because people actually want to hear what you have to say. Now, the third reason, I guess, that I want to submit to you to think about, why bother? Well, because it's up to all of us, really, to build a better conversation about science. Now, I could talk a lot about COVID. That would be a different talk that I've been giving a lot lately about what we've learned from COVID. But because COP26 is going on this week, I'm also thinking about the kinds of conversations we need to have about sustainability. And I noticed that the medical physics community has been absolutely on the front foot in looking at sustainable solutions for all kinds of, for safe nuclear disposal, et cetera, et cetera. And so I think there's a real opportunity for people in this field to help us, help all of us, have the very hard conversation we need to have about the, about that nexus between environment, health, and innovation, and how we are actually going to build a better world by exploring these areas and having the difficult conversations we need to have. So those are the three reasons I submit to you you should care about science communication, because it's the right thing to do, the responsible thing to do, because it will make innovation happen at a faster rate, perhaps, because people want to know, and finally, because we all have to be responsible for a better conversation. So with that introduction, I am now going to hand over to Jean Erdmann, I believe, who is going to start her presentation. Thank you very much.
Thank you very much. And thank you, Dr. Rehani, for inviting me today. It's just a pleasure and honor to be here. I know that now people hear what you want, people want to hear what you have to say. I'm going to tell you a little bit about how to say it, and I have some very simple and effective tips that you can communicate your own work with and the field of medical physicists. As a journalist specializing in health and scientists, I need to interview scientists. I can't do my job without you, and so I'm always happy and humbled when you take the time to talk to me. And as we know, science communication, including journalism, is more important than ever because we are still living with the deadly consequences of science and public health issues that are not being communicated properly. A fellow journalist in my writers group made a comment recently that really fits well with what we're talking about today. We'd been discussing a famous American football player who lied about his vaccination status, as it turns out, and who apparently thinks that homeopathic and disproven remedies are a match for the virus, and now he's positive. But here's what my friend said. The truth is very nuanced and complicated, while misinformation is very simple and appealing. So how can we best communicate the scientific truths that link together all of our lives? I can't advance my slide, Madan. Do you want to put it on the next one? And it's not a big deal. I can talk without slides. For a lot of us, that begins with writing. I write stories and researchers write abstracts and manuscripts and grants. And many of you are presenting at this meeting and you write newsletters. But the one thing that I want to start out by saying, as a print journalist, who write for a living, many of us, and I can speak for all of us probably, hate sitting down to write that first draft. It's hard work. And writing is something that even for those of us who do this for a living, have to work at almost constantly. So one of the things that I want you to do, and this is just what I'm going to talk about today, is to think about your work differently in terms of how you communicate. And this will help you write clearly and concisely, and then engaging the public. If you want your work to be heard, then communicate in a public space. Okay, you can advance my slide if you like. So one of the things that I want you to start by doing is simplifying your work in your own mind. Before you try to communicate this, and this is not a 3-minute slam, this is even shorter than that. I want you to summarize your work in one sentence, thinking about what the most important thing people need to know about your work is, and you can't use jargon. And I'm telling you, this is not dumbing down your work. It takes a lot of thought and a lot of effort to do this because it's much easier just to spew out some jargon that only your closest colleagues will understand, but you're also going to narrow access to your work. And a good way to do this is just to either look at what's called a deck. It's the little sentence that's below stories, the titles of stories and feature stories, or you can go to scientific journals and look at the single sentence that's below the title. You can advance the slides. And one of the things that I gave as an example of, and the only one that I'm going to read is the middle one, that's on the mind, what placebo effect looks like in the brain. That's your title. The deck is, and this is how I want you to summarize your science. When pain relief is expected, specific circuits in the brain become more active. Now, I used to go to the Society for Neuroscience every year and cover it for places like Science and Nature. And I can tell you that those talks weren't simple, but this is still how I want you to think about your work, because it, as I said, it will narrow. If all you're going to do is communicate, is so dense and so impenetrable, you're going to vastly limit your audience. So you need to answer this question. What does someone need to know about my work? What's the most important thing that you need to know about my work? I've been writing a lot for Discover lately, and a few months ago I was working on a story and I can't even remember which one it was. And I read a paper that I thought would really fit well, but I didn't really understand it. So I read it and I wrote up a quick summary of the work. It was small, and I sent it to the researcher. And I said, you know, I'm working on this story. I read your paper. Did I get this right? And so he spent a lot of words telling me that he didn't have time to talk to me, which is fine. I didn't really expect it. But he ended by saying, read the paper. And I wanted to say, dude, if you could write, I wouldn't be asking. So since I couldn't be confident in my interpretation of what he said, I just didn't include the paper. And so that's why I say, you know, you're limiting who your audience is if you don't communicate it well. Okay, Madan, you can advance the slide. The other thing that I want you to think about is just, well, stop using jargon, but think about the story you're telling, because it doesn't matter if I'm writing a news feature or a straight up news story, or you're writing a manuscript or a grant or an abstract, you are still telling a story. So you have to think about how you're putting that together. I used to teach grant writing to medical fellows at Washington University. And one of the things that I used to tell them was, think about the order of the work, think about the order of what you're writing. And so the first thing that I told them was that you don't really even have to start worrying about your writing. I want you to read, and I want you to pay attention to how you read. Read newspapers, read inside your field, read outside your field. If you're reading a paper in your field and it's flowing really well, or it's not, if you're stopping every 2 minutes and thinking, okay, what is this person trying to say? Then stop and pay attention to kind of analyze a little bit of what those problems are. Is it flowing because they have a really good explanation for a complicated concept? Is it not flowing because the sentences are too long, or they're all the same length and it becomes monotonous, so you just stop paying attention? So that's what I mean by reading critically. If you learn to read critically, if you change how you read, that will really change how you write, honestly, before you put pen to paper. And a really simple explanation that I used to give to the medical fellows is, think about how you tell a joke. If absolutely every line is perfect, then the punchline is effective. If you've got even one sentence out of place, then you're losing it. So learning how to like I said, learning how to critical reader will vastly improve your writing. And then finally, I want to talk about social media. You can advance the slide, Madan. I can't say that I'm the best person on Twitter. I don't even have a lot of followers on Twitter, but I'm on Twitter all the time because I follow scientists, I follow patient advocacy groups. So use social media, reach out. I know that there are problems with Twitter and Facebook today and Instagram, but there are also places where scientists gather, and also members of advocacy groups for different diseases, patients for different diseases, and just the general public. And I would say, go on Twitter, follow people inside your field, follow people outside your field, join conversations with cardiologists or oncologists or journalists. Follow journalists. We follow you. And the same with Facebook. And the final thing that I'll say here is, write an op-ed. If you see something that's happening that your field can answer, then write an op-ed and submit it to your local newspaper. The final slides that I have are some resources for you. They're on how to communicate science. There are a lot of tips here, and they're all tried and true. They're going to tell you not to use jargon. They're going to tell you to simplify your sentences. And it's not because we're all plagiarizing each other. It's because these are the tips that work and work well and work consistently. And I've also found some, there's 2 slides. I've also found some groups on Facebook that you can join if you want, that are scientists and their members, and they're about science communication. So that's all I have. Thank you very much. Yes, and I hope you don't hate us. Thank you.
Okay, I guess I'm up next. Thank you. I found the 2 presentations by Jean and Joan to be extremely informative and echo a lot of, obviously, the work that Atomic Reporters tries to do, because it is working in the field of science communication, although of course we have a rather broad range. First of all, I wanted to thank the International Organization for Medical Physics for this invitation on the International Day of Medical Physics. And in particular, I want to thank Madan Rehani. I have a disclosure, he's already provided this information, but we worked together in the IAEA when I was an International Atomic Energy Agency, if you don't recognize the acronym, where I was a press officer for many years, and have great admiration for the efforts that Madan made to reach out to the public and in particular to inform patients. I am probably medically weird from the point of view that my brain is divided between having been a journalist and having been a press officer. As a press officer, it was slightly different, obviously, as you can imagine. From being a journalist, we had to, have sensitivity towards member states. However, on one occasion, when I was making a similar presentation to this as a press officer in the IEA, I was urging the participants in the meeting to work with journalists, to engage journalists, to inform journalists, when one of the participants responded, "But how can we trust them?" And at that moment, the journalist brain took over, and I said, "But how can we trust you?" So the point I'm trying to make is that there is an issue of trust, and is something that Joan talked about in a different context, but there's an issue of trust between journalists and scientists. And I wanted to address that and to try to establish that there was some clear beneficial outcomes from working together. And I say working together because I think there has to be mutual trust, but obviously that doesn't come about overnight. It takes a lot of work. And I will get to this at the end of my few comments, but I'll show you what we were able to produce, what Atomic Reporters was able to produce as a result of a workshop with journalists and specialists in 2016. I think that the important thing is to basically reach out as you would to your colleagues in your profession. You probably don't know, I don't know, the 1,000, 1,200, however many members there are in your organization, but there's a means of reaching them, and then of course you have to determine whether you can work together, whether there's the grounds for an effective relationship. It's the same premise working with journalists. If you can find journalists who are interested in the work that you're doing, invite them to share some of the information that you are able to provide. And to put it cynically, health stories sell. Everybody, is a little bit concerned about their health. What's that twitch in the left eye? Does it mean I'm having a stroke or whatever? So you have a relatively easy row to hoe. And of course it's going back to some of the points that Joan and Jean were making about advancing medical physics education, and of course it does behoove you to be a little more outgoing, particularly in an environment that is contaminated by misinformation that we're all only too well aware of at the moment. So how do you do it though? How do you establish this symbiotic relationship, which I'm claiming you can benefit from? Well, engagement. How do you find an environment for engagement? We'll come to that in a moment. But I think you can formalize the approach by inviting journalists to an informal briefing, let me just go back one step. Look, a journalist has to have a story in order to justify a commitment of time. As I said before, health-related issues are extremely of great concern to most people, and I'm quite sure you can wherever you are working, find communities of journalists with whom you can work, because the idea is not to have a pick up the phone one day and say, please, we want to talk to you. You have to have a prior working relationship. What we did in 2016 was invite journalists to a workshop. You'll see the illustrations on the screen in front of you, and we were. I'm just going to go back to the earliest slide if I can. No, I can't. Madan, that's good. So that okay. Thank you. That's good. We can advance that, Madan. Thank you. Good. And then let's go to the next screen, please. Okay, good. The workshop involved journalists, in fact, from many countries, from Japan, from Georgia, from the United States, from Russia. And it was concerned at that time with nuclear security, which I'm sure if you any of you who work with radiological sources are very well aware of. And the nuclear security issue was something that was probably distant for most journalists, and we had the challenge of making it more meaningful for the participants in the workshop. So what we came up with was a collaborative approach to develop safety guidelines, because this may be an approach that you could take with journalists as well. We wanted to raise, and we certainly did with journalists in the 3-day event, what would you do in the event of a nuclear emergency? What would you do in the event of it? It doesn't have to be a non-state act of a terrorism event. It could be a simple accident, and it just happens, sadly, not infrequently. How do you communicate to the public? How do you address public fears? Also, how does a journalist protect herself? What are the steps to take? And we wanted to put the issue, fairly and squarely in the hands of the journalists to respond to. So out of that came, and Madan, maybe you could advance the next slide, please. Out of that came a set of recommendations for journalists, working journalists, who in most cases would be among first responders. They would be with the fire service. They would be with the health services if there was a radiological event. And so the idea was to come up with a simple set of rules. You have to ask yourselves, is there some parallel that would address issues concerning the work that you are doing? In our case, it was I think fairly straightforward. We also had an engagement, I should say, in this workshop between quite a number of health physicists, experts, a few emergency response experts, but it was mostly the health physicists, and they were the ones who explained, for example, ionizing radiation to journalists, because you're probably aware, if you work in the field of applications, the public is not very well informed, and there does tend to be a great anxiety. Next screen, please, Madan. Then the other outcome of this workshop, which was valuable, and I think goes to the nub of what I'm trying to stress here, is that the journalists had very valuable information to provide to the broader community. And the journalists not only you know, from their background working, you know, in reporting news, but also from the point of view that the journalists have to have, as Jean just pointed out, the ability to take complicated issues and break them down so that the public understand them. And this in a way is what came out of these recommendations. We had the perspective of journalists, we engaged journalists, and we gave them the floor. And perhaps this is something that you can consider, because if it's one-sided communication, it's not going to be effective. Not only do you have to engage, you also have to listen, as we did in our workshop in Rotterdam. And I think the results 5 years later stand, they're still relevant. We obviously work ongoing work with journalists. We're working with young citizen journalists today. There are communities that you can reach, and I'm sure that with some effort you will enjoy the rewards. And finally, a point. Consider young people when you're reaching out to the communities. And you heard me mention citizen journalism. But the point I wanted to make is that, and this is one of these statistics that I hope doesn't prove to be wrong, but young people under the age of 18 will make up 60% of the urban population of the world by 2030. And I don't think anyone here would not fail to recognize the name Annika Thunborg. Young people are demanding a voice, and they should be considered in our communication outreach. And I thank you very much.
Thank you, all the three speakers. Maybe Ibrahim, can you start with the...
Yeah, thank you very much for all the speakers. Before I start, I would like to congratulate my colleagues across the world. Happy Medical Physics Day. And I know that during the last 2 decades, a lot of things has been done to make our voice heard. Many organizations in the medical physics, as well as colleagues, senior colleagues, try their best to show what medical physics do. And it's now turn for our young generation and our students to take the lead and go up front using the latest technology in communication and media. I have some questions to our speakers. I start first with Hughes Wilkins. He's asking about any advice. He's asking Juan in particular about any advice for scientists facing retaliation from their employers after raising evidence-based concerns with managers in the course of seeking healthcare improvements. What you can say about that, Juan?
Yeah, look, I mean, that's a fantastic question. And I was just on a panel last week where I was hearing from colleagues epidemiologists who are getting death threats from the kind of work that they do. So incredibly harrowing retaliation for, talking about their work. And Hughes kind of got the answer, I think, quite rightly in his question. I think professional societies have a really important part to play in coming up with frameworks, but also, just defense of people who are brave enough to go and talk to people like Jean or Peter. That they share their time, they share their expertise, and after it's over, there's not a lot of aftercare that goes on, right? People have their 5 minutes in the media sunlight, and then they kind of move on. And I think that's a place where professional societies are really important, and academies across the world. This is a big issue for them, and I know that you know, at the International Science Academy, they've been talking about this. That there needs to be both frameworks and support for people who speak out. So I think it's a great question, and it needs a lot more attention.
Yes, thank you very much. I have a question again from you. You are trying to hear the interest from Jean and Peter about the use of Facebook in science communication. So we'd like to hear from Jean and then Peter about Facebook in communication, science communication.
Sure. I personally, I tend to be an introvert. I'm not the best person on social media, but I do use Facebook. I keep track with friends and families, but mostly for to boost my stories and to boost stories that my friends have written. And there's just like a special group that we use that are just, you know, some special group studies that are just my own peers. It's not perfect. It's not, I don't even know where it's going to go. I'm very unhappy with what I've read about them in the media. But for now, I sort of use it because I'm not sure what the next alternative is going to be. But you know, I included 2 Facebook groups in the slides. You don't have to go to the slides. I've got them. I've got them on a separate screen. There was one that I looked at that was a science communication group from India, the India SciComm India Science, Technology and Engineering, and it looked like they had some really good discussions going. I found another one on the Global Network for Science Communication. I mean, even right now, if that's sort of where you stay, if you stay on Facebook, but you stay within those groups, you might get some tips, you might get some story ideas, you might get some ideas for how to, you know, what to use on Twitter, or even what to use if you decide to write an op-ed or engage in social media. But like I said, for now, it's sort of not perfect, but I'm not sure what else we can use.
Peter, thank you, Chen.
I think we need to consider social media platforms like Facebook and Twitter as the commons where we have the right to go. Atomic Reporters announces events on Facebook. I can't say we get into much debate on Facebook, but we would, if we try to set the record straight on something, we would post it on Twitter, Facebook, and LinkedIn. So yes, I think you know, use social media as best you can, and just watch out for the trolls.
Yes, yeah. Saying about the Twitter, I would like to say something about that. You know, in Lebanon, the head of a university hospital, he engaged in Twitter, you know, telling about the COVID-19 cases in his hospital. And he uses, as Jen says, very simple language to the public. You know, he's a physician, but he used very simple language to the public. And your point is very crucial, because he ended up being the Minister of Health in Lebanon. You know, so the exact powerful skills of the Twitter issue makes, you know, things happen in a very drastic way. So this is the things that the social media has an effect on the whole of the community that will, you know, make tremendous outcomes positive in this way, right? I have a question from our friend Haroon. Hi, Haroon. He says that scientists needs to communicate in the language of journalists. Any advice how to do that? He's asking the 3 speakers. We start with Joanne.
Well, I mean, I'm probably the last one you should ask, because I mean, yeah, some of the stuff I publish is pretty esoteric as well. So I can sympathize with the difficulties of having to think differently about your writing, as Jean invited us to do. I think that's the best advice, you know, to think differently about it. But it's also about being audience oriented, like not necessarily telling people what you want them to know, but trying to find out what people want to know from you. And I think that switch is sort of key to really good communication.
Peter? Again, what scientists need to communicate?
I think Ibrahim, that the issue is that journalists shouldn't play the role of scientists, and perhaps scientists shouldn't play the role of journalists. And the point I'm trying to make is that there's a means of building a bridge between science and journalism, media, however you want to define it, that is available. And the skills of journalists, just as the skills of scientists take a long while to develop, why reinvent the wheel? Engage with journalists, find ways that journalists can amplify, deliver the message that you're trying to provide.
Good. Jean?
I can answer that, and I'm glad you asked it,
yes.
Because as I listened to the other talks, I thought, I wish, this is what I wish I'd said, because we had the 5 W's in journalism: who, what, where, when, why, and why now. And these are the questions that you need to answer as a scientist. And when I left the lab, I didn't find journalism that different than science. When I was in the lab and I had to start a new research project, the very first thing that I did was I went to the medical and scientific literature to see what had been done in this and what my new project was going to bring to this. And so, you know, if you are trying to communicate, you can say who you are. You're all experts in your field, what you're writing about, why this is important. And this is the most important question one of the most important questions that I have to answer when I write a story. And it's the most important question that you have to answer when you're communicating anything about your work, and it doesn't matter the platform, is why now? Why do we have to know this now? If I'm going to write about nuclear safety and I am 60 miles almost to the degree directly east of a nuclear power plant, I have to know why now. What's changed in the field? Have the regulations changed? Have they made it safer? Have they made us less safe? So that's where I see the overlapping fields of science and journalism.
Thank you very much. I have another question to Joanne and others from Horvig Hersak. He's asking that, do you think presenting medical physics professional status and problems to the wider public could harm efforts in resolving these problems, especially relating to these stakeholders such as Ministry of Health and hospital management? Any data about experience in such situations?
Yeah, so I mean, that kind of connects up to another question about transparency and worries about transparency. Look, I mean, if there's a problem, it's going to out, right?
Yes.
And if there are issues, you want to get in front of those issues. You want to talk to people about those issues. You want to explain those, have people be able, I mean, this is kind of, you know, when I talk about responsible research and innovation, one of the things that they talk about is behaving in an anticipatory way, kind of anticipating what problems are going to kind of blow up in your face. And I think, I mean, you know, in a sense, it's an ethical question that's being asked about transparency. And I would go on that side of transparency, but I think it's also about anticipation and helping the field become safer, become better, become more innovative. Yeah.
Peter? Thank you.
I echo what Joan said, and from our perspective, you know, I think there's clear evidence that public participation in nuclear safety is absolutely key, and it does of course go back to this issue of transparency. If there was more transparency, perhaps we wouldn't have the space for as much disinformation as there is out there today. That there would be more solid guardrails, you know, preventing, you know, the truth, if you want to call it that, going off the road. Yeah.
Jen?
Yeah, I'll agree. Better you control the message. I mean, you don't write a grant or a manuscript without bringing up and addressing and anticipating criticism, because it makes it stronger. it's the same here. And as Joan said, it's going to come out, and it's better you that brings it out.
Yes. Okay. I have a question to Peter. You said that health sells fast, right? In your opinion, which type of story sells fast? Those with positive outcomes or those with negative ones? Because let me give you an example. For example, in our field, if a medical physicist like invents something, maybe it would be like very difficult to spread the word of positive impact. Whereas if a medical physicist did something wrong or a small, mistake, he will be or she will be on the media. So how is the journalist, could help in, shining the light on the positive impact of our profession?
There's no guaranteed outcome, and thank you for the question. I think it goes back to what Jean was just saying, that it's the issue of transparency. It's the issue of from my perspective, of building communities of trust, being prepared, so that if you do have an emergency, if there is a slight lodged against the negative issue, because there always will be a negative issue, despite our best intentions. If you worked with journalists, you're much more likely to have a positive I don't mean a positive outcome, but you're much more likely to have an authentic response, a response that actually goes to the issues, and perhaps may even help to establish trust with the public, because the woman or the guy who quotes on the street and who quotes, they tend to feel isolated from the world of science, which is lab coats and laboratories and all kinds of weird things going on they don't understand. But if it was a human issue, I'm sure that there would be much more identification. So you just have to, as Jean said, be prepared, and have journalists you're working with who you can say, hey, listen, we want to tell you about this, we want to explain this, do you remember, blah blah blah, so that there is some it's an insurance, but it doesn't mean that the insurance is going to save prevent an accident.
Yeah, thank you. I have a question to Jean. You said that Twitter is now an effective, all the social media effective means of communications. Do you think, in your opinion, now the hard copies of newspaper, journals, books would be outdated now? People not using it?
I guess effective can be both ways. It can be effective in a good way and effective in a bad way. I guess because I'm older and old school, I still read newspapers, and I still read, I read everything. Yeah, I don't think newspapers are outdated. I think that, and then this is hard to say, but I think that the pandemic was probably the best thing that happened to some newspapers and journalists, because I think that people look to newspapers. I'll just use the New York Times or the Washington Post or your local newspaper for what's going on. I mean, when I go on Twitter, when I'm trying to find out what's happening in a certain community, I will go to the local newspaper in that community, and I read local stories. I still think, to me, they're much more important. I mean, print is hard these days. There's an awful lot of magazines that don't exist anymore or only exist in print form. And there are a lot of newspapers that are surviving by, staying print and by making their web presence much more engaging.
Oh, thank you. And I have probably one last question because of the time constraint to Joanne. You said that there are scientific communication is a very good tools to proceed the science effect. What useful tools that we might use in our medical physics profession to help in our science communication?
Yeah, thank you for that. It's a brilliant question. I think Peter kind of had a little bit of that embedded in his talk as well when he was talking about working with citizen journalists and young people. There's all kinds of ways in which you can set up groups, whether to work with, for example, patient groups. There's ways in which you can set up things like science shops where you engage with the public, pop-up science. You got science in the pub. I mean, there's a million and one ways that you can engage in your area. And some of the links that Jean had in her talk kind of lead you to those, or the RRI in the EU tools will also lead you to, I mean, an entire world of ideas if you want to engage. But I mean, the one thing I would say though, we talked a lot about the media, and I tend to do that too, but it's still the case that the one-on-one conversations people have in the pub, with an Uber driver, with your taxi driver, those count for a lot. And if we were all out there and having those conversations every day, I think the world would be a better place for science, to be honest.
Yeah, thank you very much. Thank you all for your invaluable comments and answering the questions. It was lovely to have you all. Apart from medical physics, we have new colleagues on the group, and I will leave the floor to Madan for his final comments. Thank you very much.
Thank you, Ibrahim. Thank you, all the speakers, John, Jean, Peter, for the wonderful talks and the wonderful discussion. Time is always tight, so we may not have been able to attend to all the questions, but I saw John very, very active on the chat, so she has responded to many questions already through the chat. Thank you, John. So thanks to all of you for participating in this session, and happy International Day of Medical Physics to you. And thanks to Magdalena for all the technical backup. Sometime glitches and all, they come, like today, the slide change and all, but otherwise everything has gone well. So with that, I thank all of you once again profoundly, and have a wonderful day, rest of the day or evening or good night. All the best to you.
Goodbye.